Well, thank you and good morning. It's a pleasure to be with you and share with you a little bit about this. Somebody said to me this morning, they said, Paul said you were supposed to be positive in your speaking, and your title isn't very positive. I said, well, it's provocative. That's the point, and we'll see if we come to some conclusions by the end of this. What do we have, 3 hours? Something like that? Yeah. So this is my family. This is who I spend my time in Africa with, although they've gotten older and moved on. When we first went to Kenya, my wife and I had a 12-month-old boy, and he's the one with the wife there on the far left of your picture, graduated from college and in the Air Force, and so times have changed, and we now have 5, and adding one more daughter-in-law in a couple months. So that continues to grow. But my kids all grew up pretty much in Africa, exclusively in Africa. That's their home. That's where they see home. And we'll be heading back with one daughter, our 13-year-old. Everybody else is either in college or out of college. And she'll be heading back with us to go to boarding school at the Rift Valley Academy. As was mentioned, I work at a place called Tenwek Hospital, which is in western Kenya. First visited there in 1992 and then came back full-time in 97 and have been there since then full-time. And it's been really exciting to see what God has done. And we're going to this morning, as was mentioned in the little blurb, we're going to talk about the good, the bad, and the ugly. Now, we're going to do the Lakewood version. So, we're going to be polite and thoughtful. And some of you, the younger ones here, have no idea what the good and the bad and the ugly is. If I whistled the theme song, you wouldn't even know what that was. But those older ones will certainly know, and we're going to talk about that as far as short-term medical mission work. Is there any value whatsoever to short-term medical missions? And I would like to hear your thoughts. I'll try to leave some time to get thoughts, and I know there are many here who've taken short-term medical trips, and some of you are contemplating it. And some of you may come to this talk saying, well, I was planning on it, but now I don't know, because he's questioning if there's any value whatsoever. But we'll talk about that. A lot of what I'll present to you comes out of a chapter I wrote in a book just recently published last year on global surgery, which is, so I'm a surgeon, and you'll hear things from a surgical perspective. So those of you who are medical doctors, medical type, you'll bear that in mind, that it's a surgeon speaking to you. But we at Tenwek we're, I think, the largest facility that World Medical Mission sends doctors to. So we have about 130, 140 visiting doctors per year. So we have a lot of experience with short-term visitors. And we're going to talk about the good, the bad, and the ugly and then as we conclude, talk about what does that mean for you in short-term medical missions work. So in this particular chapter, we talked about various models of provision of subspecialty care. And you should bear in mind, this is a text on global surgery. It's not a book for Christian missions per se. It's a secular view of the effectiveness of various models to affect global surgery. And we look at a number of different platforms or methods, including short-term trips. So we term them short-term surgical trips, STSs, and there's other models. There's government initiatives, there's university and academic participation, there's telemedicine. Some people are doing telemedicine partnering. There are faith-based hospitals like ours, Tenwek Hospital, and we're going to talk about what they each have their own advantages and disadvantages to them. And I hope what you'll come away from this is that none of these are mutually exclusive. They can be competitive and antagonistic, and that's the ugly. That's how it shouldn't be. They can be complementary and working together and growing together for the long-term goals, and that's what we want to talk about. If you look at investment of time, and again, this was a chapter on subspecialty surgical care, so short-term teams coming to do, cleft lips and palates. In my area, come and do heart surgery. to do ophthalmologic surgery, do things like that that are short-term and focused. The investment of time is quite variable if you're talking about that, because for a short-term trip, you could be talking of days. Some people come 4 days of surgery, and we're going to get a ton of cases done in those 4 days. To the other end, our faith-based hospitals. So Tenwek started in 1937 and has been active ever since. So those take decades and centuries to build, and some of those goals are much longer. The speaker last night talked about some of those issues, keeping the long-term goals in mind, and I hope we can find a happy medium. If I challenge your thoughts, feel free to speak up and let's have a discussion about that. Because again, I'm tipping my hand a little. I don't think these are mutually exclusive. It's the key of harmonizing them all and working together to make them work for everyone's benefit. If you think about the personnel involved in these type of things, on the one extreme, you can have short-term specialty surgical care, which comes in and brings an entire team and does everything for a week. We're going to talk about the advantages and disadvantages of that. On the other extreme, you will have things like our hospital or others where we're very interested in task shifting. We're looking at long-term goals of teaching and training and sustainability over time. So the amount of personnel and the outside involvement varies significantly between these different models. So here's one, and I'm going to hone in on this because I know you can't read that from the back, but we're going to hone in on this a little bit. What are the advantages and disadvantages of, in this model, short-term surgical trips, which could be broadened to short-term medical trips of any type? So the good, again, you younger folks saying, who is this guy? The older ones, Dr. Paul would be appalled because he kind of looks like him now, doesn't he? With that beard and you got to get that little cheroot cigarette sticking out of the side. But so what are some of the benefits of the good of short-term medical trips? Well, there's a potential for large volumes of patients cared for. So, for example, my good friend Ben Roberts, who's the ophthalmologist at Tenwek, goes off 3 or 4 times a year to different underserved areas. So you might say, I thought you work in an underserved area. Well, we do, but it's all relative. So where we are at Tenwek Hospital, they think we're in the Mayo Clinic of Africa. And so you go 50 miles away to Mfangano Island in Lake Victoria, and there's nothing. There's no medical care. And they'll take a team and do cataract surgery, and they'll do 100 cataracts in a week. And so you can get a lot of patients taken care of, and in their setting, that's one of their goals, is to meet the needs of many people in a short period of time. Now, they take evangelists, they take others, they try to make this a holistic experience. But that's certainly a benefit, getting a lot of people treated in a short period of time. There's a potential to advance long-term partnerships and collaborations. And I do think that is a very important point. And before I may mention this several times throughout this talk, that in my way of thinking, to my understanding, the most effective short-term missions are the ones that come repeatedly back to the same place, over and over and over, as opposed to, I've been to 60 different mission hospitals over the last 40 years. I go to a different one every year and spend a week. You reinvent the wheel a lot of times. You see a lot of cool stuff, and if that's your motivation, we're going to get to motivation, to see a lot of cool stuff and visit every country in the world, then that may meet your needs. But as far as the long-term goals of the institution you're working with, pick an institution and keep going back there, because your first trip there, you won't be nearly as effective as your 5th trip there. You'll be stumbling over yourself trying to read books about malaria or leprosy or typhoid and wondering if you should run home and take your Cipro because you may have just been exposed and your GI tract's a little off and you can't stand on rounds for too long. You have to slip off and you'll find there's no good toilet in the hospital that you're working in. There's a pit hole somewhere, and you're gonna, the more times you go back, the more effective you'll be, and you can help Your first trip, somebody mentioned, it may have been offensive. Last night, I think the speaker said, sometimes you're more work than you are help. There's truth to that. Let me be honest, there's some truth to that. Each time you go, though, you become relatively more helpful than you are a burden because you understand the institution and you can fill in for people. So if you go to a place repeatedly and they understand you and you understand them, you can be a real blessing to a doctor who may say, or a nurse or whatever capacity you're serving in, to say, I can comfortably take 2 weeks off and he's going to cover. If Paul comes to cover me, I can walk away. Now, I don't like to because I enjoy spending time with him. And so there's that mixed thing. But if he comes there, I can just walk away and say, here's the keys, see you in 2 weeks. And I know because he knows how things work and he's been there repeatedly. It can become beneficial and easy for the participating healthcare provider. It may not be on your first trip. And you may get discouraged. And you may say, I'm not going back there again. I mean, each case is individual, but I would say that might be the place to go back because you'll be better the next time. You'll say, well, it wasn't me, it was them. Well, it's the relationship. And it's developing that relationship and getting more and more accustomed to one another. In this chapter, we quote, there's a bunch of different studies out there looking at kind of the soft science of how effective are short-term medical trips. And here's one from 2013 where they talked about making sure you have your goals and objectives before you. And I think that's very important. If you're going on a short-term team, what are your goals? Most teams come with a goal that we want to cure all cleft lips in Africa in a week, or we want to evangelize the continent. Next week, we're going to share Jesus with Africa. That's a vision, but it's not a very objective goal for a 1-week trip. So, like when our heart teams come, we're now doing our own full-time heart surgery all throughout the year, but we still have teams come to do like very small babies, to bring some specialists. That's a whole different ballgame to take care of these little tiny babies with cardiac surgery. So they'll come and we'll say, all right, in this week, we hope to do 12 cases. That's one goal, 12 cases. We're probably going to see 200 patients in the clinic and screen them and think what they need in the future for them. And we're going to have time of sharing and blessing among the team. We can get so lost in what the goals are, we forget, and I'm going to come back to this at the end, that we get focused. We're Americans. We want our projects done. What's the project? And so then if you come and say, all right, so we're going to get 10 cases done. From a dollars and cents perspective, we're going to fly 25 people over there and do 10 cases. Now, we've made partnerships. So interesting, our cardiac program, Emirates Airline pays for those teams to come. Emirates Airline, Muslim airline, pays to send people to Tenwek so that they can fix hearts. So we're able to reduce that cost down. But from a pure dollars and cents perspective, there's many times I would say, no, just send me your money and I'll operate. But that's not building relationships, and that's not the people who come, which is you all, and changing your outlook on life. We try to put an emphasis on training local healthcare providers and monitor our outcomes. And I'll get to some of that when we come to the bad. There are bad things about short-term trips. In our particular chapter, we call it challenges, but what it means is bad things that we hope not to happen. So challenges. At times, you can have relatively worse outcomes and little continuity of care. You come into a place where somebody may have a lot of knowledge, but very little local knowledge, very little understanding of how healthcare systems work. So for example, you may come and say, oh, all right, let's put him on, he'll go on home subcutaneous heparin, then he'll switch to Coumadin, he'll get his INR checked once a week, visiting nurse will come and check his wounds, good, we're all good. Well, none of that's gonna happen. Absolutely zero, because there's no infrastructure for that to happen. And you're going to be frustrated and say, well, this is what I would do at home. Well, you're not at home anymore. And working with the local team to say, what's achievable? What's a reasonable goal. So like in heart surgery, we've piloted many of our patients who in the US would be on high-dose Coumadin or home on aspirin. And we're following those patients and going to present it next year. And some of the valve companies are very interested in what we're doing because that could change the game in the Western world if we can show that that's safe. But for us, it's only practical. It's what we have to do. There is the potential to overwhelm the capacity of infrastructure in place. Because you'll come as a visiting team or a visiting group and you say, I'm here for 1 week. I want to work all day and all night, and I want to take care of as many patients as I can. And your host may say, we're not doing that. You see, but here's another kid. We could operate on this kid tonight. And I say, yeah, but our staff need to go home. Because there'll be another team next week. And next week, this is life for them. It's not just a 1 week out of a year. So being sensitive to those needs, and those are difficult. So like when I have these discussions with our own staff, and at Tenwek we're bumping into each other now so we built a new surgical center in 2005 with 5 operating rooms. We now have about 8, and we thought we'd be set for years. And now we have orthopedic surgery and neurosurgery and pediatric surgery and GYN surgery and cardiac surgery, and we're just bumping into each other all the time. And I can play the trump card, which sometimes I do. There's a couple trump cards. One is to say, well, I'm the head of this department, and this is what we're going to do. The other trump card is to say, all right, so sure, we'll cancel my case. She's a 9-year-old girl. She's probably going to die. I'll send her home to die. That's okay. Why don't you go tell her that's what we're going to do, and we'll let you do your hernia. This is how life goes sometimes. But we're trying to get along. You can overwhelm the capacity. And when I run a whole week so what I do now is 3 days a week of open heart, and I'll do 2 cases usually per day. I could do 3, but it'll overwhelm our facility because the recovery room is full. You come in the morning, there's no beds in recovery. There's no bed. The ER is full. The hospital is full. You're trying to figure out where to put people so that you can continue doing operations. And we need to be thoughtful about that and keep the long goal in mind. You might say, but I'm only here for a week or 2 weeks. That's right, but things continue beyond your time. The institution will continue. And they're often not conducive to healthcare system strengthening. They're conducive to getting a bunch of patients seen in a short period of time, but they're not conducive to growing that institution, and that's because of mixed objectives or divergent objectives. And I think, again, harmonizing these objectives is what we need to do. So I mentioned there's a whole bunch of studies, which you can look in that chapter, and again, you can't see that, but I'm going to focus in on just a couple of them. So here was one from 2004. A well-intentioned guy on a short term said, one should never perform an operation abroad that one would not perform at home. These are some guidelines. Well, I understand the thinking of that, yeah, if you're a pediatric oncologist, you probably shouldn't go to Africa and do heart surgery. That you shouldn't do that just because you can. But to me, there's a big elephant in the room when you make such a statement. Which is that elephants are in the room. This is my daughter with some elephants at the Nairobi Elephant Orphanage. And elephants are beautiful creatures and majestic, and we live actually very close to the game parks where you can see them and interact with them in their natural habitat. But they also can get dangerous. So this was a patient they called me about one night at 2:30 in the morning, and I was really tired, and I was asleep. The resident starts talking to me, and I say, so are you talking about a gunshot injury? And he said, no. I said, well, you're telling me about an exit and an entry wound. Yes. I said, well, so it's a gunshot? No, it's an elephant injury. I said, elephant with an entry and an exit? You mean like a goring? He said, yeah. I said, wow, that's, because elephants usually just stomp on you. When we have elephant attacks, which we do not infrequently, they stomp on you and break your ribs and your pelvis and long bones and other things, but they don't gore you. So this guy, there's 2 arrows. One is his entry wound in his left flank. The other is the exit wound in his sternum, and that's what that wound in his sternum looked like. And he told me the elephant picked him up off the ground and he saw a tusk coming out of his chest. He's 20 feet off the ground, and then the elephant tossed him off. So how many of you have done that operation before? So if I said, I've never done that, I don't think so, we'll refer you to the elephant specialist. It's just not going to happen. There has to be some flexibility to say, I'm willing to stretch myself within the right limits. And this is all keeping perspective. You can swing this pendulum one way or the other. And I've seen surgeons who say, I'm not going to, so like for visiting surgeons from America, they would say, I do gallbladders and appendixes. That's what I do. And I say, well, you might have to stretch to the small intestine. You might have to stretch to the colon or to the thyroid. Well, I haven't done thyroid in years. I know you haven't, but you can, Or you may do things, I'm not asking a pediatrician to take out a thyroid cancer. That's not appropriate. But you may stretch within your field to things you haven't seen. Here's an x-ray that brought me one night when I was in the operating room. And this is during a bit of a violent outbreak, and somebody shot with an arrow. So I showed this at a radiology conference once, and the radiologist said, I see you have a pointer pointing at something, but it looks like a normal x-ray to me. I said, well, yeah, the pointer is the major problem here. It shouldn't be there. And if you take an AP view of that, that's the arrow dead center at C2. And this is what the patient looked like getting ready to operate. That's the arrow coming out of the back of his neck. So how many of you have done that operation? An arrow through the spinal cord at C1, C2. If you Google it, you won't find anything. If you look in the textbooks, you won't find it. There's no reference to go to about arrows through the spinal cord. So I understand the sentiment, but there are times you have to be willing to stretch. With God's grace, that's that man going home. Truly God's grace. With a little paresthesia in the ulnar distribution of one hand, which I said, I think you can live with that. That'll be absolutely fine. You were skewered through your spinal cord. Some others that give some very specifics about do's and don'ts, recommendations. This is Don Meyer from Vanderbilt and spent many years in Nigeria and taking teams back and forth. And he talks about these cultural things. Remember, you're a guest and respect the culture. That's going to mean different things in different cultures. If you're in a Muslim culture, it may mean covering your head, which you may say, but I'm free to not cover my head. Listen to the people there. Listen to what the culture tells you. In our setting, it may be, we have this old, Paul knows him well, Reverend Keelel, the director of spiritual ministries, and he came to me one day, he said, okay, so I understand the women are now wearing pants. Okay, I can get that, but please tell them, not the tight ones, please. Although I notice here, I should come to Lakewood, I need to get skinny, tight black jeans. If I'm gonna fit in, I need to do that. But, so maybe I'm not culturally sensitive because I'm wearing old-fashioned clothes. Don't try to make sweeping reforms. I can't tell you the number of people that have come and said, do you realize you could be more effective in your turnaround time in the OR and you could get a first start at the right time every day? And there's a lot of things you could do to improve. And I say, wow, that's a revelation. I never thought of that. I know we could, and we're trying to make little steps, piece by piece. And if you stand back and look at 20 years, we've made a huge change and a huge difference. So it's not to say, again, keep all these things in perspective. It's not, people will come to me quiet and say, I've noticed a few things, and they'll tell me, and I say, yeah, we've thought of that. But then they'll come up with something, I say, that's a really good idea, Understanding that you'll have good ideas too, but you're probably not going to get them instituted in the 1 week you're there. Talk to the long-term person, say, just an idea, just a thought. You probably thought of this already, but maybe you could do this. All these types of things. When we have new missionaries, which we've just had recently, they talked last night about the fact that the numbers have gone way down of full-time missionaries. Well, we've had a few new ones, and I will tell them, like we had a surgeon couple join us 2 years ago. I said, don't make any suggestions for 6 months. Just just fit in. After 6 months, then tell me what you think we should change. And they were able to see that longer view and say, wow, I can see how this is frustrating. And I first thought we should just fire this guy and fire that one and hire him. There are histories to a lot of those things that you won't know about. And here they've suggested the same thing. Plan follow-up trips to the same locale. If you can go back repeatedly to the same institution, you will become more effective each time you go. And then there's one author gave a list of sins, the following sins that short-term teams shouldn't do. And he talked about not matching technology to local needs and abilities. And that's true. That was one of the reasons I personally fought for years starting heart surgery at Tenwek. I said, we can't do this. I'd been trained in it, but I said, the technology is too much. We're not going to be able to do this. Well, we've been able to develop now local avenues of getting the supplies we need. It started with everybody bringing in things, but we were able to switch to having locally supplied needs. And so, again, keep those goals in mind. If what you're proposing is going to be utterly dependent on you coming back every year and bringing the goods, that's not a long-term solution. That may help to start something, but it's not a long-term solution. And then having disingenuous motivations. That's written down there. So the ugly. Let's talk about the ugly for a minute. Motivations. So let me give you some quotes, some actual quotes of people who've been at, first let me say we've had hundreds and hundreds, thousands of doctors and nurses, and you know that 99.99% of them do wonderful. They're there as humble servants to serve the Lord. Every now and again, like everywhere else in life, you get something else. So one guy, I said, so what brought you here? He said, well, I've made a lot of money and I think I owe something back to God. I've been in practice for 50 years. I'm very wealthy and now I'm going to pay my debt back. I said, really, in 1 week you're going to pay your debt back to God? That's impressive. I have to see what kind of work you do. Even when I come back every 4 years and work short time at Brown University Medical Center. And I have colleagues who'll say, have you paid your debt back? Are you done with this God thing? You come back and do real life. And I'll say, you know, if it were about a debt, I'd be in deep trouble because you're never going to pay that debt. So it can't be about paying back a debt you owe. Or another guy said, well, I'm better. Honestly, I'm better than anyone else, and I feel like I should share that with the world. So, wow, that's amazing. Again, I got to see how you operate because this is going to be impressive. Another said, I want to feel better about myself, and I think this trip might be therapeutic for me. Okay, sounds like you need therapy. I can recommend a few people to you. Now, contrast those, because it's a subtle difference, but it's an important difference. With the same type of motivations, instead of I've made a lot of money and I owe a debt to God, how about I feel blessed by God and I want to share that with others? It's a subtle difference, but it's crucial. What is your motivation in coming to do something like this? I would like to use the abilities and talents I have to advance God's kingdom. As a humble servant of the Lord, I've been blessed and I have some skills and abilities and I'd like to share those as best I can. And I want to purposefully put myself in places where God can speak to me. God does speak many times to the teams that are there and changes people's hearts. And honestly, that's, if you're coming for 1 week, that's the biggest thing. It's not how many cases you get done. It's what God will probably do in your heart when you're there. Not what you're going to give, but what God will do to you. Very different, but I want to put myself in a place. I mentioned this time commitment. And one thing we state in this chapter is that the key question is not related to where along that continuum the individual provider finds himself, but rather that he or she is moving in the right direction. The place you're coming to help and serve, are they moving in the direction that has common objectives with you, which is let's help this place develop its resources, develop its sustainability. We can make sustainability a god of its own, and I object to that at times, where that's the sole measure. Are they financially self-sufficient? That's the only measure of an institution. And honestly, you're hard-pressed to find when we have such a disparity of economic income and GDP and everything else from country to country to find a mission hospital that's going to be totally independent. Tenwek is. For our operational expenses, we're self-sufficient. We don't need outside support. For capital things like building a brand new cardiothoracic unit, which we're doing, we do. But, it's what are the goals of this plan? If the plan is we're going to come every year for 3 years and then we're going to stop, I would say find a different mission. Find a different short-term trip to take, because that doesn't have what I think is important, which are the long-term effects. Often the change in your own perspective will be more valuable than any other goal or objective you might set. Change in yourself and the change in your team may be the most important thing. Here's a quote from a Oxford poet from the 1500s. Very often, change of self is needed more than a change of scene. Now, the two are not mutually exclusive. It's something to keep in mind, that sometimes a change of scene facilitates a change of self. And asking God to open your eyes when you're there to what are the needs and what are the places you can fill in that. But bear in mind that it's what changes in you is often. So what are the take-home points? Contemplate your motivation. I'll often ask people the first time they come, I say, why are you here? Well, and I've given you a few of the answers. What's going to be your answer to that? When somebody says, why are you doing this trip? What for? What are your answers? What's your motivation? Understand clearly your goals and objectives. And if you're a team, try to share those. And be reasonable. You're not going to cure AIDS in the week you're there. You're not going to fix all the cleft lips or all the cataracts or save all the children. What are your goals? And not just in number of patients, but what are your goals as a team to grow and develop spiritually within your own group and individually? Know that the most successful trips combine elements of giving of yourself and allowing yourselves to be changed also. This was a picture, and I'm going to end with these last two pictures. This is a group of residents at a Christmas party when we were setting up a tree. I put this up only to the Ben Franklin guy. He's graduated last year. He's a surgeon up in northern Kenya, teaching at the Eldoret training program. The next one is at a mission hospital about 40 miles from us where they've never had a surgeon. He was their first surgeon. And the fourth one over, John just joined him last year. And now they've got 2 surgeons at this hospital. Has never had surgeons, and they're hiring a 3rd out of our graduating class this year. They'll be an independent, they're going to start their own residency. This is the long-term goals I'm talking about. Agneta, the 3rd one, is joining us as the first cardiothoracic fellow, and she will be the congenital heart surgeon for sub-Saharan Africa. Full stop. Elijah is at Chagoria Presbyterian Hospital, first surgeon they've ever had there at a mission hospital, and Jack is in Western Kenya. That's how I spend my time every day with those people investing in long-term, decades, lifetime commitment to make a difference. So, in conclusion, our short-term medical mission trips of any value whatsoever, I would say yes, with the right motivation, goals, and vulnerability. God can use short-term trips to move you and change you and bring about good for the world. And I'd be happy to entertain any questions or thoughts. So please, if I've hit a nerve or a question, a comment, now's your time. Yes? Right. Sure. So the question about short-term, in her case, pharmacy. Again, my suggestion would be, so are you, I'm going to direct this is rhetorical, not just to you alone, but so are you working with the local providers to help encourage them and train them so that they will be more and more able to take up what you're doing? You're right. If you give 30 days of drugs to somebody and that's the end of it, you might as well not give it to them. You know, it's unless you're talking antibiotics for infections or something, but you're not going to make a lifelong change in people. So, like when our cardiac, since they've been coming from the first day, and every time a new team comes, I tell them, look, your main job here is to train our people. Now, we're going to do that by taking care of a bunch of patients. And there will be times you need to do things because it's a new trainee, but by the time you leave here, I expect you to be able to tell me what you've taught and see the progress in our nurses, in our pharmacists, in our doctors, in the people that you're working alongside of. Make an investment in their lives and see what you can do to change that. And then those trips can be actually very productive. When they come over and spend time and they've left and our residents say, wow, that was great. This guy spent time with us and taught us and we really learned something we hadn't contemplated before. That's very helpful.